Hello everyone, you are all welcome to lecture number 1060, and today's topic is sciatica, pain, causes and treatment. If I say sciatica, it refers to the radiation of pain, the traveling of the pain from the lumbar 5 vertebral column, because our vertebral column is numbered, from neck up to the last bone. The first group, they are called cervical, that is C1 to C7, then thoracic, and after that, then it is called lumbar. So mostly the problem comes between lumbar 4 and lumbar 5, and in between these two bones, that is vertebral column, there is a rubbery mass that is called disc, and serious thing is starts from that disc. Once that disc is degenerated, that is called herniated, and when in that process of degeneration, because of old age, because of injury, so many factors are there, sciatic nerve is pinched or under pressure or is disturbed, and that's why the pain radiates from the lumbar 5 vertebra to your hip, to your buttock, and then to your leg. That is called sciatica. And why sciatica is very much in news nowadays? Maybe because of lifestyle. Today, millions of people are suffering. For example, in Nigeria, more than 1.6 million every year they suffer from sciatica pain. In India, more than 20 million people are suffering from sciatica, and not only in India, in that subcontinent, Pakistan, Bangladesh, is a serious issue, and it is very much, we can say, painful in Middle East, Abu Dhabi, Dubai, Saudi Arabia, Qatar. In Qatar, there is the best institute, medical center of treatment of sciatica. Turkey is also one of the best place to treat sciatica. So sciatica is actually a serious matter because it is reducing the quality of life. It's a very deep pain, radiation, traveling of deep pain from your back of the lumbar 5 area up to your hip, up to your buttock, and to your leg. And you will be forced to spend sleepless night. So that's why it is necessary to understand what is the cause. First cause is, that is age factor. Once you are aged, maybe about 50, 60, we can get such type of symptoms. Secondly, once you are obese, means you are carrying lot of extra weight, then we can get sciatic pain. And then profession means what type of job you have, the job of sitting, and once you are sitting, sometimes you are twisted, left or right, or you are bent. So in that position, if you are sitting for hour, 1 hour, 2 hour, it also affects the vertical column, vertical bones, and also stress and strain. That is also one of the reasons. If you are under a lot of stress, overworked, tension, that is the cause of your sciatica. And with that sciatica, one more very common word is used, that is called back pain, backache. That is the pain again in that area, that lumbar 5, lumbar 4 area, and where the bones are degenerated, I started degenerating, That is also one of the reason, and its treatment is mainly of two types. First, medication. And when I am saying medication, means physiotherapy, radiotherapy, infrared radiation, and then chemotherapy means taking some painkillers or some injections. So that is medication. And of course, management is also very important. Scientific secrets are involved, how to manage. And that is very, very important. And to my understanding, anybody who's having either back pain or sciatica, or sometimes the same thing they call it the slip of disc slip. Disc is nothing but that is rubbery material between lumbar 4 and lumbar 5, that is vertebrate column, and that is very much degenerated, and because of that reason also herniation means deformation of your rubbery material is there, which is in between lumbar 4 and lumbar 5 bone. That is called slip of the disc. There is nothing to slip. It is actually either it is deformed or degenerated, that is herniated. Only then you can, doctors is a common word, say that there is slip of disc, you take a rest maybe for 1 month, 2 months, like that. And your last option should be for your operation, because there are a lot of nerves involved in that region, and nerves are very, very complicated. In surgery, anybody can commit such type of human error where if any nerve is disturbed, is for whole life, that maybe you will get paralyzed. Paralytic attack will be there. And also, one word you might be hearing, let me show you first slowly, like your head. This is your head, and this is your vertebral column, this is your leg. Like this, for example, just a sketch diagram is human being. Here it is 1, 2, 3, 4, 5, 6, 7. This is your cervical. Then from here it starts 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 20, like that. This is your thoracic. And then here it starts 1, 2, 3, 4 and 5 L. That is your, this area is your lumbar. So it is cervical, which neck to your head. This much is your thoracic, and this area is called, that is from L1 to L5, it is called lumbar vertebrae. And here in this vertebrae are like this. This, and for example, if I am taking from here this lumbar one, so this, that is L4 and L5 will be lumbar one is like this, and in between this there is a type of this area, this type, and this is called disc. And from here, from this disc, this one, your this is called sciatic nerve. So what is happening in that lumbar, between lumbar 4 and lumbar 5, there is rubbery mass, and this rubber mass, this type of material, just like rubber, is called disc. And once this rubbery material, which is in between lumbar 4 and lumbar 5 spinal bone, that is called spinal cord, the whole from here to here, and inside there is a space where there is fluid, that is called spinal cord, and the whole area we can say vertebral column. So this vertebral column is having these type of bones, and if suppose there is any deformation, any degeneration in those bones starting from 1 to 7, that is cervical bones, then it is called cervical spondylosis. If there is degeneration and you are getting lot of problem, that is called cervical spondylosis. Cervical spondylosis means degeneration, deformation due to age, due to injury, due to sickness. And once these bones means cervical 1, C1, C2, C3, C4, C5, C6, C7, up to 7, C1 to C7. If there is any disturbance of that bone, cervical bone, then it is called cervical spondylosis. Spondylosis means it is degeneration, deformation, damage. And then if it is here in the region of either here it happens or here it happens. If it is with lumbar, then it is called lumbar spondylosis. And if it is here lumbar spondylosis, and it may cause pain, but that pain is fixed, is centralized. But once it is radiating from lumbar 4 to lumbar 5, because of the pinching of pressure of sciatic nerve due to the disc degeneration, deformation, that is called herniation of disc. And with that, then will be radiation of the pain, very deep pain, and it is radiating from your back side to your buttock, to your hip, and to your thigh. And first it will be one side, and then it can shift to other side. That is called sciatic, and pain is related to it. Sciatic means it is a pain because of disc, and doctors they call it, I have already told you, that is disc slipped. There is nothing to slip away anything, no. It's only that is herniation of, degeneration of, deformation of, under pressure because of old age, they are weak, where your sciatic nerve is under pressure, that is called sciatica. And for that, I have already told you these are the factors. And this back pain, what you are getting mostly in India subcontinent, 60% sciatica as well as backache or back pain because of lumbar, LUMBR, lumbar bone, lumbar 4 and lumbar 5 bones, that is a spinal cord, and in between those the damage of disc, rubbery material, just like plastic type spongy, that's why I call it rubbery material. When there is degeneration, that is specific term is that is herniation. So that herniation causes the sciatic nerve to have pinch, to have some pressure, and that's why we get sciatic pain. And the causes I have told you, treatment I have told you that the only way to treat is either you go for medication, scientific management. Scientific management means you follow physiotherapy, meet the physiotherapist, and he will tell you the different angle how to sleep, because sometimes by changing the side of the bed it is very sharp and deep, so you have to use pillow under your leg. Physiotherapist will advise you and reduce your pressure, tension. That is management of a sciatic condition. And for back pain also the same thing is there, that is management. And also you should reduce red meat and fat, because if there is more creatine, so is a type of protein, it can also be accumulated some places, and uric acid will be produced. So if there is more uric acid in your urine, it will be towards your degeneration of all these cartilage and bones. Also, those who are diabetic, they are at high risk. Those who are obese, they are at high risk. And those who are having the profession of sitting for a long time, and if they are keeping their head like this always, so they can have cervical spondylosis, means degeneration. Spondylosis means degeneration, deformation, damage of all these vertebral column, cervical from 1 to 7. So these are all very, very important factors. I have already told you all these things in a very simple language to understand, so that you can take care. And finally, your doctor will advise you meet him or her and go for MRI scan. With that, very clear picture will be given cell by cell, so that you can take care. So with this, I will stop. So take care of your these type of bones. First is cervical, which is directly linked to your neck. Second one is very close to your hip, that is called lumbar bone, cervical bone and lumbar bone, because these two are having pressure, and these two are more affected because of your lifestyle. That's why you get this type of degeneration, deformation. All this I have already explained. So once again, thank you very much for watching the lecture.